Hi, everybody. This is UC Light, licensed marriage and family therapist with New Growth Counseling Carlsbad. Welcome back to my channel. Today, I'm going to be talking about what parents can do when dealing with kids who are using or experimenting with substances. That's right. This is a very difficult and challenging subject because it stirs up so much for parents and kids, and it can cause a real crisis and rift in the relationship between the parent and child, as well as the family in general. So, what are parents supposed to do? Well, by the end of this video, hopefully you'll have some very clear, actionable steps as to what you can do. There are lots of things you can do, even though it's really difficult and painful. So, let's dive right in. The first thing we all know about is the danger that's involved. Substances, alcohol, they provide a threat to the child's health, right? Their developing brains can sustain injury. Kids can have overdose if they're doing something really dangerous. They can get hooked on a substance or alcohol and develop an addiction, and none of this is good for their health. The second thing we all know is that there are usually other kids and peers involved. And this represents a really powerless place for parents because they can't influence their kids as much as they would like, whereas their peer groups can. And the peers are sometimes sending really different messages that aren't as health oriented as parents would like them to be. Finally, there's the issue of the broken trust that exists when a parent finds out and the kid's been lying or hiding it or whatever, or maybe even stealing to get money. And so broken trust becomes the giant thing that defines the parent child relationship problem as you're trying to navigate helping them with substances because they may not even want help. Now, lots of parents want to know, like, how do we address the root cause? Like, what's the root cause why my kid is even doing this? And I will say that's a question for therapists to really look at. And I'm going to get at that towards the end of the session here. We're going to stay away from root causes for a moment, and we're going to say that there's either experimentation, which has its danger, or there's a deeper cause why your child is using substances. And we'll go after that in a minute. The first thing you want to know, though, is that your emotional reaction to the situation is sort of a determining factor. If you can process your emotions independent of your kid, possibly with other adults and support systems. And you can organize your emotions so that you can contain them and not go into anger and judgment around your child. That'll be the best way that you can move forward. So, the first big step I give everyone is process your emotions and learn to contain them so that you're not spewing out anger, condemnation, and disappointment with your child. That's the worst thing that you can do when trying to address the issues of substances. Now, I understand for some people, containing those emotions is extremely difficult, especially when there's a family legacy of substance use or alcoholism. Parents can become overwhelmed and distraught. It's still really important to work on this because the next step is to develop a plan that involves the relationship you have with your child. So, after you've learned to contain your emotions, you want to try and talk directly with the kid. Now, I know all circumstances are different, and a lot depends on how you found out. Did you discover substance in their drawer? Were they obviously intoxicated? Did you get did the police bring them home, or did another parent tell you about something that happened at a party? All of that's really important, but you still want to try and find a way to talk to the kid, and you want to obviously normalize that kids are experimenting and they're being curious and they've got their peers, and that this is a normal thing that happens when kids move through adolescence on their way towards greater independence and eventual autonomy. And so experimenting with substances is often part of that. You can normalize that. However, what you want to do is express your concerns about the health and then set a boundary. Like, I understand that you're experimenting and you got caught, but it's not okay. It's actually dangerous, and I don't want you to do it. That is a really important message that you need to send to kids. There's a lot of good research out there that when parents talk to their kids and they set that boundary, even though the kid can be rude and disrespectful and seemingly not care, it actually goes in. There's good research to suggest it goes in and it affects the kid in the long run. So setting the boundary and saying this is not okay is important. Giving them some simple education that they've already heard at school, but that encapsulates what your concern is I'm concerned for your brain health. I'm concerned for a habit that could form, given that we have a family history of this stuff, and so on. The big intervention is drug testing. I highly recommend drug testing. It does a lot of things. The first thing it does is it sends the message that I'm serious about this and I'm willing to invest my time and my money into this. The second thing that it does is it lets the kids tell their friends, I can't. I'm using, my mom and dad are, they're going to drug test me. I can't party with you guys tonight, or at least I can't partake. The third thing it does is it creates some accountabilities and it limits this game that people get stuck in where a parent suspects and then accuses and then a child denies but can't prove. When you're doing regular drug testing, and I do mean regular, several times, depending on how the context of how you found out, if the kid was using it a lot, you may need to do it weekly. Some people do it every 2 or 3 weeks, but the point is that for at least 6 months, you should be drug testing your kid regularly. And then if you've got the results you want, you can space it out beyond that. But drug testing takes away the guessing. The fourth thing that it does is that when the child finally tests clean, or negative as we would say, they can prove that they've been working well and they've been doing good, and you can praise them and say, good job, I'm really proud of you. So drug testing involves all of that. So I always tell parents to frame it as a way to rebuild trust that goes in both directions. Now, there are other things that you need to consider. If kids are getting into problems with drugs, substances, and alcohol, and it's really becoming a pattern, you sometimes have to break that pattern by structuring pro social experiences that involve other peers, but that there's supervision and structure. Depending on what your kid's into and what's available, this is sometimes sports, some kind of after school thing that they're doing. It can be drama. It can be anything that involves other adults who can watch them and provide structures to where they can interact and have fun and do things, and it just takes up their time. I knew a person that got their kid into rock climbing, and this exhausted the kid, and they couldn't use substances anymore because they couldn't climb the rocks that they enjoyed doing. So it's a nice kind of a diversion. You want to look for things like that. Now, I told you I'd get into root causes. Root causes can be anything. It can be something like a developing sense of self esteem that is, like self worth concerns and self esteem issues. It can be that there's been a trauma that you don't know about, that they've suffered, that they've kept inside. It can be divorce, remarriage, blended families. It can be a breakup with a significant other. It can be so many things. And to try to understand why a child is getting involved in substances and becoming attached to them involves looking for root causes. And I got to say, don't try to do this with your kid. It's the stuff of therapy. Kids don't usually have insight into the root causes that motivate them. They're following urges. They're feeling things in their body that they don't even understand. And when they do something like a substance or alcohol, it changes them in a way, and that's sort of it can get paired, right? Like they can feel negatively inside themselves. They do this thing, and that positive feeling gets paired against that negative. And now, anytime they feel that negative, they go towards the positive. Well, that's how substance abuse and addiction and dependence get started. So leave that up to a professional and try not to dig and interrogate with a kid to get at that because it's usually not going to be productive. Okay, so I've talked a lot about what to do. The main points are containing your emotions, having a conversation, and structuring in substance use and some kind of a diversion to address. And then taking a child to a therapist if you are concerned about long term use, abuse, or dependence, or a child that's just unwilling to stop. If that's the case, you can do all these things that I suggest, but a family therapist is your best call because a family therapist as opposed to an individual, will work with the entire system to try to understand. I do hate to say this, but sometimes substance abuse problems are related to a poor parent child attachment or a bond that's becoming, or attachment bond that's becoming frayed at the seams and is coming apart, or a child is going through a developmental stage and the parent is not parenting them in a way that they need and it's causing distress. So it's hard to say it, but sometimes we as parents are part of the problem. And whenever that's the case, you want to work with a family therapist who's going to work with the parents and the kid and any other siblings that are necessary in order to get at the root cause driving it. Okay, so that's the overview of what to do with substances. If you find this content helpful, please like, subscribe, leave a comment or a question below, and I'll get back to you. Again, this has been UC Light for New Growth Counseling Services in Carlsbad. Thanks so much for watching, and I'll see you in the next video.